schizophrenia is, its causes and effects, and some approaches to treatment both through medication and psychosocial interventions. But recovery is a lifelong journey, and the way healthcare professionals interact with patients and their caregiver can have a big influence on the treatment success. This video will discuss some of the strategies you can adopt to help forge a strong and truly collaborative relationship. We will highlight the importance of clear communication, education, motivation, and setting clear, achievable goals, all of which contribute to successful treatment plan. Paranoia and confusion, two symptoms commonly experienced by patients with schizophrenia, can make it difficult to gain the confidence of people living with schizophrenia. This can be further compounded by stigma and misinformation. For example, people believe they have gone mad or they are possessed by demons or ancestral spirits. Common myths include the idea that people living with schizophrenia have multiple and split personalities, that they are violent and will need to be kept in hospital, or even that there is no effective treatment, and therefore it is pointless to seek help. Patients may be concerned that they are a danger to loved ones and that their condition will alienate them from friends and family and harm their employment prospects or lead to institutionalization or harsh treatment against their will. Being mindful of these myths and concerns can help healthcare professionals build trusting relationships with patients and their caregivers by exposing misinformation, listening to their experiences, and addressing their concerns. In most cases, the best way to do this is by first listening carefully and sympathetically to the person's concerns. Explain that there are normal symptoms for someone with treatable mental disorder. Reassure them with facts and discuss the risks and benefits of the available treatment options. Providing treatment to patients and caregiver in a way that builds trusting relationships doesn't have to be time-consuming. A powerful tool and efficient tool that can help to make the most of your time and your patient time together is motivational interviewing. It's a communication technique that has been studied and found effective in addressing mental disorders like schizophrenia. Motivational interviewing was being developed by clinical psychologists to uncover patients' underlying beliefs, assumptions, and fears, and help them to find the motivation to make a positive change. Motivational interviewing strategies put the patient in control, letting them drive the conversation and helping you to gain a deep understanding of their treatment needs. Effective motivational interviewing techniques include affirmations, where the interviewer acknowledges that the patient or caregiver is doing well.
An example of affirmation is, "Thank you for coming today. We've discussed some difficult topics, but you stuck through it and it takes courage and strength."
Affirmations help everyone to feel they are being heard. This facilitates open and honest dialogue. Permission. Asking permission is a powerful technique that ensures the patient and caregiver is okay with sharing personal experiences or receiving information.
An example of permission is, would it be okay if I discuss some treatment options with you?
Reflective listening, a technique where we rephrase what the patient or caregiver said to clarify understanding. This is helpful in establishing trust and rapport.
An example of reflective listening is, so what I'm hearing is that you feel out of control and scared.
Open-ended questions, questions which will invite something more than yes, no, or maybe answer, and thus helping obtain more meaningful information.
Example of an open-ended question is, how do you think we can work together to help you remember to take your medication?
Normalizing, communicating to your patients and their caregiver that their difficulties and challenges are not uncommon.
An example of normalizing is, you are definitely not alone. Would it surprise you to hear that there are 100,000 people feeling just like you in Rwanda today?
And finally, summarizing, which as the name suggests, involves pulling together key parts of the conversation and repeating them back to the patient or caregiver.
An example of summarizing is, today we have talked about some of your fears, how you sometimes feel out of control and scared, but also that you are not alone in this experience and that together we can forge a hopeful path forward.
As we said at the beginning of this video, recovery is a lifelong journey, and people living with schizophrenia and their caregivers need to understand this when choosing treatment options and setting goals and expectations. They may feel overwhelmed at the beginning of their treatment journey. Many patients with schizophrenia may have suffered years of stigma, isolation, and ineffective and costly traditional or spiritual healing. And here are many options to consider, both psychosocial and pharmacological. Your support, knowledge, and guidance will be invaluable in helping them move forward. It's common for patients and caregivers to feel confused about how the various treatments work. They may have many questions around diverse topics such as methods of drug administration, efficacy, and possible side effects. The more they know about these options, the more likely they will be to agree to their treatment and stick with it. If you are unsure of the options available, please refer back to the second video in this series, Treatment Options of Schizophrenia, or consult the accompanying booklet of the same name. Like treatment options, goals for recovery will be different for each patient. They may include a commitment to attending their appointments, keeping up with medication, finding employment, or beginning or continuing education. By listening to your patients and their caregivers and using the motivational interviewing techniques discussed, you can help them identify meaningful and achievable goals for recovery. When setting goals with your patients, it can be useful to bear in mind the SMART criteria. Is the goal specific, measurable, achievable, relevant, and time trackable? These criteria will help you set relevant goals and then measure the patient progress towards achieving them. For further details on collaborating with patients and caregivers, visit the Choices in Recovery website. You can also refer to the booklet accompanying this video for worksheets that will help facilitate collaborative conversations with your patients and their caregiver and assist with goal-setting activities. In the following video, Preparing People Living with Schizophrenia for a Better Future, we'll discuss further strategies to set up patients and the caregivers for long-term treatment, to promote adherence, avoid relapses, and to improve outcomes. Thank you for your time and attention. God bless you.